Let's be honest, it's one of the most common injuries on the planet. One wrong step off a curb, an awkward landing during a game, and bam, you've got a sprained ankle. But, you know, what we thought we knew about treating them? Well, it's changed. A lot. Today, we're going to dive into the latest medical guidelines and give you the modern way to get back on your feet.
So, picture this. It just happened. You feel that sharp, nasty pain shoot up your leg. Your first instinct is probably to hobble over and grab an ice pack, right? But is that still the best move? Let's break down what the latest science really tells us step by step.
All right, before we can even talk about the new way to treat a sprain, we've got to get on the same page about what's actually happening inside your ankle when you hurt it. So let's start with the basics.
At its core, an ankle sprain is all about the ligaments. Think of these ligaments as strong, fibrous rubber bands that hold your ankle bones together. When you roll your ankle, and usually it's that inward roll, which is called an inversion trauma, you stretch or even tear those rubber bands. It's not a bone problem. It's not a muscle problem. It's all about those ligaments.
And hey, if this has happened to you, you are definitely not alone. General practitioners see about 10 of these for every 1,000 patients they have each year. It's especially common in younger folks, with the highest rates hitting people between 12 and 18 years old.
Okay, now here's where things start to get really interesting. The way doctors actually diagnose a sprain has changed pretty significantly. If you hurt your ankle, say, 20 years ago, the whole approach would be completely different from what it is today.
Back in the day, you probably heard terms like partial tear or complete tear. Doctors were really focused on figuring out the exact grade of the tear. But now, the new guidelines have simplified all that. And you might be asking why? Well, it's because without an MRI, it's almost impossible to know for sure. And even more importantly, knowing the exact type of tear doesn't really change the initial game plan for your recovery. So, we've shifted from the tiny details to what actually matters right now.
So, what this all boils down to is this. Your doctor is now focused on what they can see and test right there in the office. How bad does it hurt? How much is it swelling up? And the big one, how stable does that joint feel? It's a much more practical approach that gets you on the road to recovery way faster, without a bunch of unnecessary tests.
And this brings us to the huge question that's on pretty much everyone's mind right after it happens. Is it broken? Figuring out if you need an X-ray is absolutely critical.
Well, they don't just guess. For decades, they've been using this brilliantly simple and incredibly effective set of rules to make that call, and it helps everyone avoid needless radiation and costs.
This is the process, and it's called the Ottawa Ankle Rules. So here's how it works. A doctor's going to check for pain in very specific bony spots, the malleoli, which are those bumps on your ankle, and in your midfoot. Then comes the million-dollar question. Can you walk on it? We're talking 4 steps. If you've got pain in those specific zones, or you just can't take those 4 steps, then yeah, you're probably going to get an X-ray.
And here is why these rules are so rock solid. When they're used correctly, they are 99% effective at ruling out a fracture. Let that sink in. That means if you don't meet the criteria, your doctor can be incredibly confident that your ankle is sprained, not broken, and you get to skip that trip to radiology. It's pretty amazing.
Okay, so we've ruled out a fracture, we've diagnosed the sprain, let's get to the treatment plan. This is where some of the biggest and maybe most surprising changes have happened.
We've all had it drilled into our heads since we were kids, RICE. Rest, ice, compression, elevation. It's been the absolute cornerstone of first aid for decades. But what does the latest evidence actually have to say about it?
Okay, this might be a little shocking, but the evidence for RICE, it's shaky. The guidelines literally say the evidence is uncertain. Now, that doesn't mean it's harmful, but there's just no strong proof it actually speeds things up. Instead, the new focus is on something called functional mobilization, which is just a fancy way of saying start moving the ankle gently as your pain allows. That is now seen as the real key to a great recovery.
So your recovery plan is going to depend on that new classification system. If you have a mild injury, you might be back to normal in just a week or 2, just by loading the ankle as you feel comfortable. For a moderate to severe injury, the principle is exactly the same. Load as your pain allows, but the timeline is longer, and doing home exercises becomes really important.
So, your modern recovery toolkit has a few key things in it. You've got pain relief, of course, for comfort. You've got taping or bracing to give you some support and confidence, especially if it's a nastier sprain. Then you have home exercises, which are crucial for rebuilding strength. And notice what's at the bottom. Guided physiotherapy isn't an automatic first step anymore. It's now used much more selectively. Now, if you do need that extra support, you've got 2 main choices, tape or a brace. And the key takeaway here is huge. Medically speaking, they are considered equivalent.
One is not better than the other. The choice is totally yours based on your preference, what's more convenient, and of course, cost.
This is another one of those big shifts. Home exercises, especially ones that focus on balance and strength, are now recommended for absolutely everyone. They're proven to help reduce the risk of spraining that same ankle again. Guided physical therapy, on the other hand, is really safe for specific cases, like maybe an elite athlete, or if your recovery just seems to be stuck in neutral. For most people, there just isn't enough evidence to show it's any better than a good home program.
Recovery isn't just about getting back to normal today. It's about making sure this whole thing doesn't happen again 6 months from now. So let's talk about the long game, prevention.
So what really works to stop the next sprain? Well, the evidence is strongest for one thing, those home exercises. Specifically, exercises that train your balance and something called proprioception, which is basically your joint's sense of its own position. As for taping up before a game or wearing high tops versus low tops, well, the jury is still very much out on that. The strong evidence just isn't there yet.
And this, right here, really gets to the heart of the entire modern approach. It's all about shared decision-making. The goal is for you to understand your options, know the evidence, and work with your doctor to build a plan that actually fits your life and your goals.
Which brings us to our final thought. With this huge shift from passive treatments like ice and rest to active ones like early movement and home exercises, it really seems like the person with the most control over a successful outcome is you. So, is your recovery truly in your own hands? Based on everything we've seen, the answer seems to be a resounding yes.